One of the most common and sensitive barriers to case acceptance patients have is fear and apprehension. We've gotten very good at handling this in our office, but I want to make sure that every single one of us understands the process, the mindset, and the language that works best for these patients. The first thing is understanding where the fear may come from. Most patients who are fearful aren't just nervous about the dentist in general. Usually there's a story behind it, a specific bad experience that made them lose trust. It could have been physical pain during a procedure, something that was done without their knowledge or consent, or even a financial situation where they felt overcharged or misled. Our job in this case isn't just to treat the teeth, it's to help them feel safe again. Let me give you an example. We had a patient who, as a teenager, complained during a dental procedure that it was hurting. The dentist at the time told her to stop being a baby. That one sentence stuck with her for years. She began associating every dental visit with pain and shame. When she finally came to us, the very first thing we did was acknowledge that what she went through was not okay. Then we explained our process, that we always check with our patients, we never proceed if they're in pain, and we make sure that they're in control during the visit. For her, just hearing that we work differently and seeing that we meant it made all the difference. Another patient avoided the dentist for years. She wouldn't even answer the phone when we called. With the help of her husband, I finally got to her on the phone, and I didn't try to schedule a procedure right away. I just invited her to come in and to meet the team, to get acquainted. No pressure, no exams, no drills. The first visit was just to introduce ourselves and for her to get to know the team and letting her sit in the chair. We did nothing else. The second visit, we talked a little bit more about her concerns and showed her the tools, and gradually she became more and more comfortable enough to begin treatment. Initially, she had to take some anxiety medication, but now she doesn't have to take any medication through any of the visits. So here's how we handle these situations, whether on the phone or in person. The first thing we need to do is listen to the patient's concern. We let them share their story, their experience without interrupting them. We acknowledge and validate and tell them that it's understandable to feel this way and what they went through. And then we explain how we're different. We are specific. We talk about how we check for comfort, we involve them in the decisions, and we never surprise them with anything that they don't know. And then we go slow, gradually. Sometimes the first visit is just a meet and greet, and we sit in the chair and let them vent about their previous experiences. And then we give them control. We let them know that they can stop us at any time. And that way the patient can build trust gradually, one positive experience at a time. For the front desk or for phone calls, if you're answering the phone and the caller sounds nervous or hesitant, don't push for an appointment right away. Ask them questions like, can you tell me a little bit more about your past dental experience? What would make your visit feel safe for you? And then explain in a warm tone how we can take it one step at a time, even if that first step is just coming to meet us. Remember that for fear patients, the dentistry is secondary at first. Trust is the primary treatment. If we can win their trust, the dentistry will follow. Every interaction matters, from the very first phone call to the moment they sit in the chair. Let's keep building those experiences that turn fear into confidence.